I'm Dr. Kareko, a retina specialist and consultant ophthalmologist currently working at City Eye Hospital. And today we'll be delving a bit onto diabetic retinopathy, which is a complication that happens in patients who have diabetes, and it affects the light-sensitive part of the eye, which is the retina. And this is a complication of having high levels of glucose or sugars in the body for a long period of time. It usually affects the blood vessels in that part of the eye called the retina, and it causes them to be leaky. So diabetic retinopathy can cause blindness in patients who have diabetes. The epidemiology of diabetes world over, there's an increase in patients or people getting diabetes. Worldwide, it's estimated that by the year 2045, we'll have about a 51% increment in people who are living with diabetes. In Africa, we'll have about 143% increment by the year of 2045. In 2021, it was found that we had about 2.3 million Kenyans living with diabetes. Out of this, a third of them will have diabetic retinopathy, some form of diabetic retinopathy. And out of the third, about 10% of them will actually have sight-threatening diabetic retinopathy. So this is a condition of great concern. And the good thing is it's actually preventable once caught early. You can actually avoid or prevent blindness as a result of diabetic retinopathy. So the risk factors to one developing diabetic retinopathy: first, you have to be diabetic, and especially for those people who have had diabetes for a long time with poorly controlled sugars. By poorly controlled sugars, I mean if you have a HbA1c of more than 7. And the HbA1c is a test that is done once every 3 months, and it checks the average of blood glucose. Also, if you have hypertension, which is poorly controlled, that is, if your numbers are always above 130/80, you're at higher risk of developing diabetic retinopathy. I talked about the duration. The longer you've had diabetes, the more likely you'll have diabetic retinopathy. Also, if you have deranged or high lipid levels or high cholesterol levels. Pregnancy is also a known risk factor, and also if you're a smoker or you use tobacco. So diabetic retinopathy presents with various symptoms. In the early stages, it's usually asymptomatic, meaning that the patient will not have any complaints. They'll have normal vision, they'll not have any issues with their vision. But as the disease progresses, they'll start experiencing either blurriness of vision, dark spots in their visual field, or also floaters. Or one day they can wake up and find out that they're not able to see, sudden visual loss. And this is quite common, especially for patients who've had diabetes for a very long time and they've never had an eye checkup. And diabetic retinopathy is classified into 3 categories. We have the non-proliferative diabetic retinopathy, we have the proliferative diabetic retinopathy, and then we have what we call the diabetic macular edema. For the non-proliferative diabetic retinopathy, these are the early stages when you don't have any abnormal blood vessels forming in the retina as a result of low oxygen levels getting to the eye. By the time you're getting to the proliferative diabetic retinopathy, at this point in time now you have abnormal blood vessels forming on the retina, and these are at risk of either bleeding. So these are the patients who can wake up one day and find out they're not able to see, or this as a result of the constant leakage from the abnormal blood vessels, there's formation of a sheet of membranes over the retina that over time shrinks and causes the retina to lift off its place. And this is what we call tractional retinal detachment, which is actually this is what causes blindness in patients with diabetic retinopathy. For diabetic macular edema is when you have now leakage at the part of the eye called the macula. This is the light sensitive part of the eye, the center part of the eye. And if you have this, you have swelling of that part of the eye, and this causes blurriness of vision, inability to read. The patient will experience shadows or dark spots in the visual field. If one is found to have diabetic retinopathy, for the early stages, we usually go conservative, meaning that we just observe the patient and encourage the patient to have their systemic control, that is the blood sugar and the high blood pressure if they have high blood pressure, and also cholesterol levels to be within normal. So for HbA1c, for the sugar levels, it should be at least, they should aim for a level less than 7. For your blood pressure, you should aim for anything less than 130/80. And And of course, cholesterol, if you cannot control your cholesterol, high cholesterol levels with diet, then you're put on medication by your physician. If you're found to have the advanced stages of diabetic retinopathy, then there are different treatment modalities that can be offered to you. One, you can undergo what we call laser photocoagulation. Laser photocoagulation, or laser, just basic laser, we use light. And in this, we are using light to form small bands on the retina to increase the oxygen that is getting to the eye, preventing abnormal blood vessels from growing on the retina and now causing detachments later. The other mode of treatment, especially for the diabetic macular edema, is injections that are delivered into the eye. And if for the very advanced stages where you have the tractional retinal detachment, you are now advised to have surgery. Surgery can be done to stabilize the retina and to preserve vision. But the most important thing is that the earlier you come to hospital, the better. By the time we are getting to operating on you as a diabetic, the outcomes may be good or not be so good, depending on the stage of disease that you're found at. My message to you as we observe the World Diabetes Day is to come out for your eye screening. At least for every diabetic, you should have an annual eye checkup. Also, ensure that your blood sugars and your blood pressure is well controlled, as this is a preventable disease. We have no reason why people should be going blind as a result of diabetes, and screening is available to all. If you're a diabetic, we welcome you to CTI for your annual eye checkup. Macho Yako, Jukumu Letu. Karibuni sana.